Dr. Siobhan France here, physical therapist and wellness coach and creator of the Knee Strength Maximizer system. In today's video, I want to share with you a couple of insights, and maybe for some of you this may be a little bit shocking, but I am a part of a forum, and in this forum, there are a lot of people in there with knee pain, and they are posting a lot about what's going on with them, if they've had any kind of surgical procedure, a knee replacement, maybe if they've had some kind of scope done, any kind of procedure at all. And there is a particular person that just posted earlier today, and they said, I can't wait to have surgery so I can be pain-free. And unfortunately, that is not always the case. So I thought I'd make this video to let you know that surgery is not always the answer, and surgery is not necessarily going to fix the pain. As far as the pain is concerned, it may not take away the pain completely. It also depends on how long you've been in pain and your activity level. If you're living a sedentary lifestyle and you have a surgical intervention, whatever that may be, it doesn't necessarily mean that after you're done that you're going to be pain-free. There is a rehab process. If you're, again, a sedentary lifestyle, then that means your muscles are probably not strong enough to support your knees in the first place. And then after you have any kind of procedure done, then the strength decreases at least by 50%, if not more, depending on how long you've been in pain. And so the rehab process is going to help get you stronger and hopefully take away some of the pain, but the surgery in itself is not going to make you all of a sudden pain-free. And that's a huge misconception when a lot of my patients come into the clinic. They say things like, I'm still in pain, it's been 8 weeks, I'm still in pain, it's been 6 months. So it really just depends on what's going on and whether surgery is going to be appropriate. And there are some cases where that may be the only result. But in most cases, just keep in mind that it's not going to necessarily fix the pain or take away the pain. There is a rehab process, and the components of rehab are the things that I've explained in some of my previous videos, which are strengthening, balance, flexibility, and some cardiovascular training. And it takes all of those components to have an effective rehab program, and you want to make sure that you're following through with the rehab program. So you have some kind of surgical intervention, then you want to go through physical therapy, and maybe you're only in physical therapy for 8 weeks, which is sometimes anywhere from like 6 to 8 sessions, sometimes a little bit more depending on how frequently you've been attending. And even though you have completed physical therapy, it doesn't mean that you're better. If you do have less pain, that's awesome. If you're functioning the way that you want to, that's even better. But the downfall is that most people end up with pain later on because the rehab process takes longer than the amount of time that most people spend in physical therapy. They need more strengthening, they need more flexibility, more balance, and it's this continuous process of just healing your knees and taking care of yourself. So the main points here to take away is that surgery is not always the answer, and it's not going to be a quick fix, and it may not always take away the pain. Again, it can be very useful and beneficial to get a procedure done if it's really needed, and that's something you can talk to your doctor and your physical therapist about, because there are many times where surgery can really be avoided, and the research is really showing now that physical therapy is such a great intervention in order to help relieve pain and give you back the life that you deserve to live. So hopefully you enjoyed this video. Be sure to comment below and let me know your thoughts. If you've had any successful procedures, that is so awesome, and those are the stories I love to hear. But if you didn't and you're still dealing with pain, just know that you still need to carry out this rehab process. So leave a comment below, let me know your thoughts, and I'll see you in the next video. Thanks so much. Bye.